So I had this patient, right? And they were having trouble breathing in fully. Now, I need to mention that this is not a medical case. It is not an exacerbation of a disease or a condition. This was totally cleared as it should be. If you have any concerns of this, always get that checked out first. So in this case, it was simply that when they tried to breathe in fully, it was like it was being cut short. It was not able to achieve the full breath in, and the patient was aware of this. So, when we're looking at the rib cage and breathing in, we can look to a few areas. One being the thorax. Let's say the main one, if we're looking for some kind of a mechanical cause. The ribs articulate or join with the thoracic vertebra on the posterior side. And if they're stuck, you're not going to breathe in that well. If they're kind of gummy, if they're not working right, yeah, not so much. In this case, actually, not too bad. Or we could look to the front, where it attaches to the sternum through the cartilage, and if that's working well, we're not concerned. That's the case. Not concerned. Third option being the intercostals. Are the intercostal muscles a little overcontracted, maybe a bit tight? In this case, no. So, no big deal. Not worried there. Now, another thing that tends to happen is that the body, when breathing in fully, goes into an extended position. When breathing in fully, we actually tend to want to do this a little bit backwards. You can try it on yourself. Take a deep breath in. Your head tends to come upwards and backwards, and your thorax, your rib cage, and even your lumbar spine along with it. So breathing is really full body activity. And so what had happened is that it got highlighted in blue. No, I'm kidding. Anyways, what had happened is that this area in the low thorax, high lumbar spine, let's say L1, L2 area, had flexed. It had bent, as if it had bent forward. And, perhaps, in theory, there was a forceful impact trauma to the front of the body that bent this forward. Maybe not. Maybe it was a positional thing. Regardless, this means that when it's bent forward like this, it actually prevents the body from going into this extension posture, from going up, because it doesn't allow this section of the spine. And so even though it's not causing any major breathing problems, no real breathing problems, but this person who's trying to breathe better, trying to breathe more fully, they find that they can't get a full breath in anymore because we've got one player that won't go along with the rest of the band. So, wouldn't be a bad idea to get that moving again. Hey,